Hello, my name is Dr. Harpinder Shevchenko from Smiles by the Sea Family Dentistry, and I'm here to talk about dental bridge work today. So, one of the common questions I do get asked is what is a dental bridge? Dental bridge is an option to replace a single missing tooth or multiple missing teeth. So, bridge, as we know from the common terminology, is something where there's an anchor on one side and anchor on the other side, and it holds the things together. So, what a dental bridge is, if someone is missing a single tooth or multiple teeth, what we do is we use some anchoring teeth in the front of the space and in the behind of the space, and we create connecting crowns. So we are able to give patient a chewing surface and restore the function and restore the bite as well too. The patient can comfortably eat their foods. Another question that I do get asked is what is the difference between a bridge, dental bridge, and a denture? So those are two different options for replacing a single missing tooth or multiple missing teeth. So the biggest difference between them is denture is an option where you're able to remove that out, and you typically want to take it out for the night time so your tissues can breathe. Versus the dental bridge is a fixed option for replacing your missing teeth. Another common question I do get asked is what are the pros and cons of dental bridge? So let's talk about some of the pros first. So as we mentioned before, dental bridge is an option to replace a missing tooth or missing multiple teeth. So the pros of a dental bridge is that it's an option where you do not have to remove it. It's a fixed option for replacing a single missing tooth or multiple missing teeth. So you're able to, and it's aesthetic as well too. So the pros then come along is that it's a replacement option where you do not have to take the prosthesis out of your mouth. It stays in your mouth and you're able to keep it clean, keep your hygiene options that you've been using to maintain your teeth. You can keep those in. And also it can be very aesthetic as well too. So no one actually will know whether you have any missing teeth or not. The cons about it is more of that sometimes patients, when they're missing a single tooth or a multiple tooth, the teeth we use to anchor the bridge, sometimes the patient could have a very healthy tooth structure. So the biggest con is that in order to put a bridge for the dentist, when we're trying to put a bridge on a patient, we are actually cutting a healthy tooth structure, which as we know, we want to make sure we are able to actually maintain your teeth. So that's the biggest con of the dental bridge, is that sometimes we might be cutting a natural healthy tooth structure in order to put a bridge on the tooth. The other con is being able to clean underneath. So you have to use specific methods to keep your gums clean underneath the bridge and also maintain the good health of the anchoring teeth as well too. So those are the pretty much two biggest challenges with the dental bridges. Another question that I do get asked is what are the different types of dental bridges? So different categories on type. So one we will talk about first is that the bridge which is involving single teeth or multiple teeth. It could be on your back teeth. It could also replace front missing teeth as well too. The other type could be what the material being used. Nowadays, we are using mostly ceramic materials, which look a lot more natural and it requires less tooth cutting as well too. Other type of dental bridge could be a bridge which uses a metal underneath, metal substructure, and on top of it is a porcelain. So those are the different types of dental bridges that are commonly used these days. Another question I do get asked is what are the alternatives to a dental bridge? So there are a couple different alternatives to a dental bridge. Again, we're going to go into, there are two options. One is, are we looking for something replacement option as an option where it stays in your mouth? Other option is where something that comes in and out of your mouth. So first option would be, if you're looking for something which is fixed option, would be doing implants, which is very common these days. We are very successful and you're able to restore the function health of your mouth very easily and comfortably. Other option is doing a fixed removable option, which is doing a denture. And those denture has to be removed at night most of the time for the patients. And also it's a bit of an uncomfortable option. A lot of patients do not like the idea that dentures do move around. So fixed option is always a better option from the comfort point of view and also the aesthetics point of view and also from the liking of the patient as well too. Another question that I do get asked is what is a removable dental bridge and the one which is a fixed dental bridge? So actually, is sort of a misunderstanding with the term. There is no such thing as a removable dental bridge. So bridge is always a fixed option. What is removable is a removable denture. So I'm going to answer the difference between a removable denture and a fixed dental bridge. So removable denture is a piece of plastic with some teeth on it. It could be single tooth, it could be multiple teeth, it could be all the teeth in the patient's mouth, and it comes in and out. Typically, we ask the patients to remove them at night so your tissues can breathe and restore its health again. And dental bridge is a fixed option where we do shape around the anchoring teeth, it gets cemented on, and it just stays on there. So that is the biggest difference between a removable denture and a dental bridge. Another question that I do get asked is, what is a cantilever bridge? So cantilever bridge is a type of a dental bridge, and it's basically when on a regular dental bridge, we want to have an anchor tooth on the front and the back on both ends where we are trying to restore or bring back the missing tooth. In a cantilever bridge, which is a very unique and a limited option, it's done only in very limited cases. So your dentist will review it and take a look at it if that area where you're missing a tooth is a candidate to gain a cantilever bridge. So cantilever bridge is where we have only one anchor on the tooth and there's no anchor on the other side. So you essentially will have an anchored tooth and then there will be a tooth which is we're trying to replace. So that is a cantilever bridge. So it's going to have actually two units only, one which is anchoring tooth and the other one is the tooth which you're trying to replace. So that is what is a cantilever bridge. Another question that I do get asked is, what are the benefits of dental bridge? So the benefits of dental bridges are that restoring the function and health of that area, whether we are restoring a single tooth or whether we are restoring multiple teeth. So we are trying to bring back, we are restoring the function, we are restoring, giving patient the bite back so they're able to chew their food. And if it involves the front teeth, we are restoring the cosmetics as well too. So the patients are able to smile, speak confidently without having the hesitation that they're missing a tooth. And they're also able to chew their foods as well too. Other benefit is it's an option where it stays on your teeth. So you don't have to be removing the teeth out. It's a fixed option. It stays in your mouth and just keep it clean as your natural tooth. So those are some of the main benefits of the dental bridges. Another question that I do get asked is, what is the process of getting a dental bridge and is it painful? So let's go over to the process first. So the process that is involved for a dental bridge is that patient will come into the office, you get anesthetized, make sure you're nice and numb, and we are first going to we're going to look at the anchoring teeth. So we are going to shape those teeth. If there's any old fillings, any other old materials on it, we're going to remove that all, clean up the tooth and shape it, and you will go home with a temporary bridge. And typically, depending on your dentist, the lab they use, what is the frequency of them coming, bringing those bridges which are made by the lab, bring back. So typically you will be with the temporary bridge in your mouth for a week to 2 weeks. So then your dentist will bring you back in to the office and they will remove the temporary bridge, try on the permanent bridge and put it on, and you will be good to go and enjoy the foods and be with the restored aesthetics and function in your mouth. So the second question is that I do get asked, are they painful? So dental bridge is not painful. It's same thing like we are restoring a cavity or we are doing a single crown. You will be numb. You want to make sure you're fully numb when the dentist is working on you. And as long as you're fully numb, they are not painful. Another question I do get asked is, how long does a dental bridge last and how to take care of it? So let's first answer the question, how long does a dental bridge last? Dental bridges can last you a long time. The average lifespan could be anywhere from 10 years to 20 years. And I have seen bridges in patients' mouths over 30 years. There are other patients, if they do get any cavities or something they break, I have seen that 5 years as well too. But typical lifespan could be from 10 years to 20 years. And next question to answer is, how do I take care of that? So you are basically taking care of the dental bridge as you're taking care of your natural teeth, plus a little bit more. Because with the dental bridge, you want to make sure you're brushing your teeth the regular way that you brush your natural teeth. For the flossing, there are two ways you can floss the dental bridge so you can get more longevity out of it. and also making sure that you're maintaining the health of the gums around the tooth, which is an anchoring tooth, and also avoiding any cavities to be formed around where the dental bridge is cemented on. So two ways to floss underneath the dental bridge is something called, there are special flossers, they're called the bridge flosser. So you want to make sure you're flossing underneath with that. Another very cool tool that has come into play over the recent years is called a dental water pick. It's a very great tool. It's a great tool to use underneath those bridge areas where we have the anchoring, between the anchoring teeth underneath the missing tooth. So using a water pick, water flosser, and using the specific dental bridge floss, those are the two ways you want to floss your bridge. And definitely brushing morning and night, making sure you're routinely keeping your hygiene as the way you normally do. So those are some of the ways to maintain a good, nice, healthy bridge and getting as much life you can out of it. I hope I was able to answer some or most of your questions about dental bridges. If you need any help or have any questions, please feel free to contact us. You can reach us at our website and send an inquiry through there, which is www.smilesbythecnh.com, or you can reach us via phone, which is 603-926-8827, and I will be more than happy to help you with that.